Hi, let's talk about the pericardium, external heart features, and great vessels. The pericardium is the sac which covers the heart. It consists of two major layers, one of which is a bilayer. So the external-most part of the pericardium is the fibrous pericardium, which we can see cut and reflected laterally here. Deep to the fibrous pericardium is the serous pericardium, which has both a parietal and a visceral layer. The parietal layer of the serous pericardium adheres directly to the fibrous pericardium. So everything that we can see as this deep surface of the fibrous pericardium is in fact the parietal layer of the serous pericardium. The visceral layer of the serous pericardium adheres directly to the heart such that it becomes the most superficial layer of the heart wall. We can see that the visceral layer of the serous pericardium completely covers the heart, both the atria and the ventricles. And deep to this visceral layer, aka the epicardium, there's a variable amount of epicardial adipose tissue. This epicardial adipose tissue can be directly proportional to one's risk of cardiometabolic disease. So things like hypertension, atherosclerosis, diabetes, insulin resistance, etc. That risk increases with increasing amounts of epicardial adipose tissue. Now, the heart itself has sulci that serve as superficial reminders of deeper structures below. One of the largest of the sulci is the coronary sulcus, which I'll outline part of here. The coronary sulcus is going to separate the atria from the ventricles. So everything above the coronary sulcus will be an atrium, everything below will be a ventricle. So this is going to be in line with the fibrous skeleton of the heart. So the atrioventricular valves and the semilunar valves and the interstitial connective tissue that holds those valves together. There's also an anterior interventricular sulcus. That anterior interventricular sulcus is going to divide the right ventricle from the left ventricle. So that's where the interventricular septum is located. Now, with respect to this view of the heart, we can see several borders. So we have a right border of the heart. This right border of the heart corresponds to the right atrium. We also have a left border of the heart. The left border of the heart corresponds somewhat to the left atrium, but mostly to the left ventricle. There's also a superior border. The superior border is going to correspond to both the right and the left atria. There's an inferior border, also known as the acute margin, which is in association with both the right ventricle predominantly and a little bit of the left ventricle. And where this inferior border or acute margin meets the left border or obtuse margin, we have the apex of the heart. And the apex of the heart is going to point antero-left laterally. Now, when we think about the heart, if we were to go directly down the midline, recall that about 1/3 of the heart mass is going to be to the right of midline, whereas 2/3 will be to the left of the midline. Now, let's turn the heart around. The apex is here so that we can identify it. The posterior aspect, or the base of the heart, which we've yet to see very well, is there. This is the inferior vena cava. We can see a continuation of that coronary sulcus across there. And then there's also a posterior interventricular sulcus that's going to be superficial to the interventricular septum. So Here we're going to have predominantly the left ventricle, and here will be the right ventricle. Now there are also several surfaces of the heart that you're going to want to know about. In the anterior view, most of what we can see is going to be the anterior or sternocostal surface. So that is that structure. We also have a right surface. So think about this a little three-dimensionally. So here will be the right surface. There is a left surface. That would be that surface there. There's also a diaphragmatic surface. This is the surface which is just above the pericardium, which is fused to the diaphragm. And then finally, it's rather trapezoidally shaped. We have the base of the heart. The base of the heart is pointing posteriorly towards the vertebral column. Now there are also several great vessels that are associated with the heart. Great vessels are any vessels which directly deliver blood to the heart or directly port blood away from the heart. So the great vessels that are in association with the right atrium are the superior vena cava and the inferior vena cava. So these are the vena cavae, and all of the blood that they return to the heart is part of what we would call the caval system. Now in terms of major arteries, we have the aorta, and when it leaves the heart, it's the ascending aorta, and then it's the arch of the aorta, and then it's the descending aorta with both thoracic and abdominal parts, depending on whether you're in the thorax or the abdominal pelvic cavity. And then there is also the pulmonary trunk, and that pulmonary trunk divides into the pulmonary arteries, both right and left, although those pulmonary arteries are not part of the great vessels because they don't leave the heart directly. And then finally, flanking the base of the heart, we have the 4 pulmonary veins, and this one is a little collapsed. So from this angle, we could also see the inferior vena cava, the superior vena cava, the pulmonary trunk, and the ascending aorta going into the aortic arch. Thank you very much for your time.